Hello, everyone. My name is Dr. Yonit Arthur. You are on the Steady Coach. And today we are taking a deep dive into EMDR, eye movement desensitization and reprocessing therapy, with certified mental health counselor Melissa Spaulding. Melissa currently practices in Utah. She is also a certified EMDR therapist and an EMDRIA approved consultant. She has also personally worked with people who are dealing with chronic pain and chronic dizziness. In this interview, we're going to talk about why EMDR works, when it should be used, and when EMDR shouldn't be used as a blunt force instrument. You're going to walk away with some understanding of whether EMDR might be helpful to you on your chronic dizziness recovery journey. Not everyone needs therapeutic support, but some of you do. And I want to arm you with as much information as you need to make good decisions about what's best for you. You'll also walk away with some ideas of how to look for a qualified therapist who's going to be most helpful for you in your journey. I think you're going to get a lot out of this interview. Please enjoy. And of course, as always, if you would like to support me and make sure I reach more people, please like, share, subscribe. Or if you're listening to this as a podcast, you can leave us a 5-star rating or you can follow the podcast. All of these things really help. Now, without further ado, please enjoy this conversation with Melissa. All right, Melissa, hello. Welcome. Thank you so much for being here.
I'm so excited to be here.
I'm excited that you're here. I was just telling you offline that let's just say you come very, very highly recommended. Not that there's any pressure or anything. So I know that I'm going to learn a lot today and that my audience is going to learn a lot today. And hopefully we'll also have some fun in the process. So
I love getting to teach and talk about trauma and EMDR. So
wonderful. Okay, so actually, thank you for saying that. So I know we're going to be talking primarily about EMDR today, and we'll be talking about a little bit of other stuff around EMDR that's not exactly EMDR. But before we do that, just wondering if you could just briefly tell us about yourself. And also, I happen to know you have experience working with people with mind-body physical symptoms. So it'd be so nice if you could share with the audience just kind of generally what that experience has been.
Absolutely. So my name is Melissa Spaulding. I am a licensed clinical mental health counselor in the state of Utah, and I'm the owner of Guided Wellness Counseling in St. George, Utah, which is right outside Zion National Park. It's beautiful. Absolutely love being here. And my specialty is working with women that are overcoming depression, anxiety, and trauma, or maybe they have a diagnosis of PTSD. But I've been doing EMDR therapy since 2012. Someone called me an old timer recently, and they're like, "Oh, you're one of the originals." And I'm like, "Really?"
That's not that. It feels like not that long, but then again, I think
like
you
not
and I.
that long ago.
Yeah.
But EMDR has been a really wonderful approach for my clients that do struggle with a mind-body disorder or chronic pain. I think what makes those experiences really unique is there's this element of feeling like your body is betraying you. And our body is really one of the most intimate relationships that we have. We're in it all day long, and we want to expect some sort of consistency and trust that if I treat you this way, you'll treat me that way. And mind-body disorders, medically unexplained symptoms, chronic pain, they just blow that right out of the water. And so that in and of itself, and experiencing those symptoms also becomes an experience of trauma in a sense, because of that betrayal and that loss of safety within our own skin.
Wow. Thank you for speaking to that, because this is a question I've been asked. So, because obviously, often I'm telling people, hey, it's really important to understand what got you here. Like, what are some of the stressors that may have led you to be, or led your nervous system really to be a little more vulnerable to this particular situation? But you're right in that the actual onset of symptoms itself can be a traumatic experience for people. And we know that your risk of having post-traumatic symptoms is influenced by, of course, things that happened to you previously, which hopefully we'll be able to touch on a little bit today. But I'm glad that you came out and said that just upfront, because I think people need to hear that and have that validated. That onset, especially of a vestibular disorder, can be incredibly traumatic.
Absolutely.
Yeah. So one of the things you said, kind of when we were chatting a little bit before we scheduled our interview, was that you have a head, heart, and body approach to therapy. So
Yes,
could you expand on what that means a little bit?
absolutely.
Mm-hmm.
So the head, heart, body approach is really so well encompassed in EMDR therapy. So the way that I explain therapy to people is that if all you needed to do was talk about your problems, you would have called up a girlfriend and you would have talked about it and you would have moved on, right? Like, we need more than just talking, because the talking is like, oh, like it's all coming from up here, right? But there's a difference between how things are held in our mind, how they're held emotionally, and how they're held in our body. So an example of this is, we can know one thing, but feel another thing. We can know, for example, that the end of a relationship is good for us, that it just wasn't working and it's time for it to be done. And we can still grieve the loss of it, or be angry that it didn't turn out the way that we had hoped, right? We can be elated to get a diagnosis that finally fits, and feel confused and scared that now the course of treatment is X, Y, or Z, right? I can love my kid and be incredibly frustrated with him and not want to see him or talk to him.
Right. Totally identify with that last one.
We can have all these things.
Yeah.
And so it's important to have that head, heart, body approach, because we want to be well regulated, right? We want for our head and our heart and our body to be talking to each other and making sense of the world at the same time. Otherwise, we just end up spinning toxic positivity. We just end up being, I'm just going to do these affirmations. I'm just going to do yoga. I'm just going to, and it's almost like spot treating whatever is causing us this discomfort when we don't approach all three at once.
Interesting. Okay. Interesting. So it seems like, I guess the first, and I'm translating this into my own words. And as you know, EMDR is a therapeutic modality I am not trained in. So please feel free to translate then back what I say into how EMDR may see this. But what I'm hearing you say is, first, in order to get anywhere, we have to make space for the fact that we have multiple truths or multiple things going on at once. So just bringing this home for someone who has chronic dizziness, you can both watch my channel and say, oh my gosh, that's me. I have neural circuit dizziness. Hooray. I know all the things I need to do, and still feel completely terrified of your symptoms. Those two things can happen at once. But the first key that I'm hearing from you is, we have to be willing to look at that and say, these are both happening. We can't, if you're denying that the body and the feelings are saying one thing and your head saying something else, if you're just trying to push through, kind of letting your head lead, then it's not going to be as effective. Let's put it that way.
Absolutely. Absolutely. In fact, before I lived in Utah, I was living in Arizona. And where I was living, there was quite a large Navajo population. And I was explaining this head, heart, body approach to one of my Navajo clients. And she just looked at me and she goes, oh, the three brains.
Oh, interesting. Yeah.
And I was like, yes, we have three brains. We've got one between our ears. We've got one kind of here, right? If we're representing emotions. And then we've got this nervous system, which is its own sensory, experience. We have three brains. And so when we're just trying to logic our way through and we say, well, that shouldn't bother me anymore, that couldn't possibly be affecting my dizziness, that doesn't make any sense. Mm-hmm. That's coming from up here. Your nervous system has a different truth.
Yes. Wow. Okay. So I think I know where we're going with this conversation, but when you said that, what came to mind was, it's like when I ask someone, how was your childhood? And they say, oh, it was good. Yeah, it was good. Really good. First of all, that always makes me feel very suspicious. But again, many of my clients have this experience of really, truly, if you look at the facts, great childhoods, had parents who took care of them, or, there were little things, but there are people out there who've had it so much worse. I say to people, your nervous system understands safety and not safety. That's it. It speaks the language of safety. It doesn't speak the language of, oh, there was someone out there who might have had it worse. So I think where we're going now is, because I want to ask you about like what does trauma even mean? Like who needs a trauma informed approach, a heart, mind, body approach. Most people have these multiple layers of experience with a particular situation, and those multiple layers may not agree with each other.
Yeah.
So maybe you can clarify for us, when we're talking about doing something like EMDR or another experiential type of therapy versus kind of your standard psychoanalysis or talk therapy, who needs that kind of approach, in your opinion?
Oh, this is where it's important to have a really good therapist who can help you discern it, because that's a really big question. I think that I'm going to answer it by talking about what trauma is and how people experience their pain, so that maybe your audience who's listening can kind of begin to discern for themselves if this might be appropriate.
Sure.
So something that is traumatic is really anything that is a threat or creates actual harm to your sense of safety, stability, or personhood. So like who you are as a person is threatened or wrong or made to be bad, right? This might happen to you, or it might be something that is just in your space, right? This can include things like we call it vicarious trauma, where it didn't happen to you, but you witnessed it. Or it didn't happen to you, but you were aware that it was happening somewhere in the world. And that was very difficult to deal with. It made you feel unsafe knowing that was just out there. Right.
Or if your cultural group was going through something.
Your cultural group, right? There's a belief among your cultural group that something, that you are not safe, that your value is not secure, that who you are as a person is wrong, bad, awful, right? So that's sort of a broad definition of trauma. And again, it doesn't matter, that can be physical, it can be sexual, it can be emotional, right? So it can be somebody saying something to you versus something happening to your body. What's happened more recently in this conversation around trauma that I'm grateful for, and I'm also going to tell you why it doesn't work.
Okay. Yes.
Conversation, which is a good conversation about big T and little t trauma. So big T trauma is what we would typically think of as, oh my God, that's awful, right? Someone having to go off to war and having bullets whizzing by their head, being in a house that's burning down, some sort of assault, right? The things that we see at the news that we go, oh my gosh, anyone in their right mind would be shaken by that, right? That's sort of that big T trauma. Little T trauma is the stuff where we're including things like bullying, teasing, neglect, stuff that was maybe happening around you, right? We call this, oh gosh, I'm going to lose the word for it. Covert abuse is what I talk about with my clients, right? So maybe like this might include, for example, I work with women that have sexual trauma, and they might say like, well, nothing bad ever happened to me, but like this relative would always just happen to walk into my room when I was changing, right? But nothing bad ever happened, but it was always like awkward and really inconvenient. Right. I'm like, yeah, that's some covert, sneaky stuff, right? We can call like, I don't know what that was, but it never felt right. I felt weird. I felt gross when I was near this person. Something's going on, grooming maybe, right? So we can put this in the category of little T trauma. What's great about this is this conversation has really opened up for people like, wow, like it's okay to say that this thing is affecting me, right? That like maybe this, you're dizzy. Ooh, like everybody gets dizzy, right? It gives people a permission to say like, no, like this dizziness is not your dizziness. And here's how it's affecting me. And I don't know where my life is going, right? Maybe it's not my house is burning down, but this is a big deal, right? It's encouraging this conversation to say, we can call this trauma. What isn't helpful about this conversation is that we're still talking about events and experiences. And really, trauma is not what happened to us, it's how it's affecting us. So it doesn't matter if it's big, if it's little, if it was one time, or if it was every day. If it's bothering you, it matters. And we deserve to have safe places where we can regularly go to share that, to be vulnerable with a trusted person and have an approach that's not just going to talk us out of why that's actually not a big deal or here's how to shift your mindset around it, but also to talk how it's sitting with our nervous system, that it's affecting our sleep, our digestion, our sense of stability, our experience of our pain. Because there's not just the pain, there's also the emotional reaction that we have to that pain. It encompasses all of that. And so I'm really grateful for the conversations that are happening around trauma and around emotional distress, because that word trauma still might not resonate for people, and that's okay. You don't need to have trauma for EMDR to be an effective application.
Ooh, we're going to come back to what you just said in a second. Just taking a moment to highlight some of the really important things that you just said, because I think this is one of the common threads that I see in people with chronic dizziness, and I'm sure you see a lot in your practice. There's a tendency to invalidate or minimize their own suffering, your own suffering, and just getting to the recognition that something may have affected you without having been a big deal thing on the outside, or something your adult self, I suppose, the adult in the room might interpret as a big deal. Like, oh, everything ended up okay. Why am I still upset about that? We do need to recognize that is affecting your nervous system. It is affecting your nervous system. It is. It just is. It's what programmed your nervous system to begin with. So if we're dealing with a nervous system sensitivity problem, which is what a lot of chronic dizziness is, then we'd better be looking at everything that might be causing your nervous system to be extra sensitive. And many of those answers have nothing to do with the dizziness itself. It has to do with how you're reacting to the dizziness, the things that happened long before you ever had symptoms.
And if I can just speak to that, I love to share this story because I can chuckle at it now. But years ago, my maternal grandmother had cancer. She had struggled on and off with cancer for years, maybe 6 years or so. She's since passed, but there was a Christmas where I was visiting my in-laws and I had strep throat and my throat was so sore and I was trying to have the Christmas spirit and be a good guest. And I remember thinking, Melissa, it's not like you have cancer, suck it up, right? Which is the equivalent of imagining me visiting my sweet grandmother and her saying to me, Melissa, shut up. It's not like you have cancer. She would have never said that to me.
No one would have said that to you.
Nobody likes having, no one would have said that.
Right.
But that's essentially what we're telling ourselves when we compare our pain to other people's pain.
Yep.
Is we're saying, shut up, I have it worse. Most people, that's not true. Everyone's pain is unique and valid. And your nervous system doesn't care if your neighbor has it worse. Your nervous system is just feeding you signs and symptoms that you're going to have to cope with regardless of who has it better or worse than you.
Mic drop on that last statement. I want to put that on a t-shirt, what you just said. Brilliant. Brilliant. I love how passionate you are about this. I think we're kindred spirits on this. So now that we've kind of laid the foundation of what trauma is and isn't, and kind of the background of why this might be affecting your nervous system. And I have other interviews where we've explored this in a little more detail. I'd love to know more about EMDR. So could you just give us kind of the nuts and bolts, what EMDR is? And then I would also just love to understand what a session looks like as someone who has not had EMDR. I'm curious, and I know others would be curious as well.
Absolutely. So I want to start by saying that EMDR has been around quite a while. A lot of people think it's new and it's edgy and it is amazing, but it's been around since the 80s. It took a while to catch on because the woman that created it, Francine Shapiro, was a woman in the mental health and medical care field. So she wasn't taken seriously. And it felt very woo. Like, we didn't have the brain imagery back in the 80s that we have now that shows this does affect how our brains and our nerve, that this particular method does affect how our brains and our nervous system function. We didn't have that. So it was, without all that proof, it was like, yeah, we're going to move our eyes around and feel better. Sure. Right. Now we have the research. So what EMDR effectively does is that it's a therapeutic method that involves bilateral stimulation. All bilateral stimulation is a back and forth. If I go like this is bilateral stimulation, bilaterally moving. EMDR was originally including bilateral eye movements. So just moving eyes left and right. We now know that not everybody is comfortable moving their eyes that way. People with dyslexia, dry eye contacts, dizziness, hello, might struggle with those eye movements. So you don't have to do eye movements. There's audio tones that you can listen to that beep in the ears. There's tapping. A lot of my clients love tapping. But the reason why this bilateral stimulation is important is because it soothes the nervous system. It seems to activate the part of our brain that is assessing safety. And it also capitalizes on a natural movement that our bodies employ when we are, what is the word I'm looking for? Consolidating memories. So that's a big term. Let me break that down for a second.
I was hoping you were going to get into memory reconsolidation. Here we are. Yes.
Right. So consolidating memories is basically a fancy word for your brain has to decide on a daily moment to moment basis what's important and what's not important. Right. It's the reason why when we were in high school, our teacher said the night before an exam, get a good night's rest. Because when we get really good deep sleep, that's when our brain goes into that process of what do I need to remember tomorrow? How much emphasis do I need to give it? What can I let go? Like, how much did I tip the barista? I don't need to remember that in a week, right? I might not need to remember it tomorrow. Things like my childhood phone number, I can still remember that. My brain was like, that is important because I used it every day and it filed it back and filed it back and filed it back till it's solid, right? What happens when we experience something deeply unsettling is our brain is struggling to make sense of it. What does this mean? How do I manage it? I feel powerless to fix this and feel better. And so it's like it keeps it here all the time. I tell people it's like you have a Post-it note on your forehead that says chronic pain, chronic dizziness. And everything that you do throughout the day is going through this filter of, well, I don't know how I'm going to do that if I feel dizzy. And I feel dizzy right now. And so my brain is foggy. And so, when we have these traumatic experiences, these deeply unsettling experiences, we need to help our brain figure out, what does this mean for us? How do we feel about it? And here's how the nervous system is going to break that down and give us a body sensation of maybe safety, stability, hope, tolerance for the discomfort, whatever it is. So EMDR, the bilateral movements, provide a process by which that happens. At the end of the day, this is a simple way of thinking of it, is that when a baby is upset and needs comforting, what do? We hold that baby and we bilaterally move. Our systems crave that bilateral movement as a way to regulate our nervous system. And so EMDR uses that.
Interesting. So what I'm hearing is, and again, EMDR is not something that I'm trained in, but I know a lot about memory reconsolidation, and I'm trained in other modalities that use a lot of the same principles. So the idea with the bilateral stimulation is it to help the brain get access to some of those emotional learnings, to some of those, wow, this is important tags, so that we can then access it and process it differently? Is that the purpose of it?
Yes.
Yeah.
Absolutely.
It's making me think of something that I've heard or think about in terms of maybe I'm going in a weird direction here, but bear with me. When we think about attachment, like when you think about a toddler who's exploring the world, the toddler will go out into the playground, like run around, but then there's always like, oh, is mom still there? Okay, cool. She's still here. I'm good. I can keep going. I can keep exploring. It seems like a sense of safety is a prerequisite for any kind of emotional flexibility, or not emotional flexibility, for really any kind of brain neuroplasticity or brain plasticity. So is that kind of the thinking behind the bilateral stimulation with EMDR, creating safety?
Absolutely. That's definitely a part of it. You hit the nail on the head. We don't learn and heal outside of safety.
Mm-hmm. Mm-hmm.
It's one of the reasons why children or therapists that work with children that do play therapy, why they're utilizing play so much is because we don't play, we don't learn, we don't create until we feel safety. And so they're using that play to assess the safety in the room. And then from there, if the child is playing well, they can begin to, translate into what that child needs to learn. But the same is true for people when they come into therapy. That's a deeply vulnerable experience. They may not feel safe within themselves saying the things that they're about to say. They're worried about feeling stupid. They're worried about looking dramatic. They've already been told by professionals that it's all in their head.
Right. Just anxiety.
It's just anxiety. And so the bilaterals help people cope with the emotions. Many of my clients, when they're doing the bilaterals, when we're doing EMDR, and we'll talk about what a session looks like, I think that'll kind of help make this really clear, is they'll say, you know what, the bilaterals help me feel my emotion and it comes up like a wave, and then it helps it pass. And I come down on the other side.
Okay.
Right. And I'll see my clients go through that in session, right? We'll be working on a particular thought, right? Like I am helpless, and they'll be thinking about it and doing some bilaterals, and I'll see them get tearful and kind of go, right? And they come down the other side of it. The bilaterals help people move through that work.
Bringing us back to what you were saying earlier about the session. I'd love to know more about what a session looks like.
Mm-hmm. So there's a lot of things that happen during EMDR. For as much as I just talked about bilaterals, that's one small chunk of the EMDR process. And it's important for people to know that, because many people arrive and they're wanting to do EMDR and then they get frustrated that they're not doing the eye movements, right? And it's like, hold on, slow your roll. Like there's history and stabilization that needs to happen before that. So the general flow of EMDR is that a person is going to talk with their therapist first about what the target is, right? What do we want to work on? Is it hopelessness around symptoms, right? Is it frustration with the pain? Is it something you're feeling triggered by something that keeps coming up in your life or your relationships? So you're going to focus figure out what to focus on. And then you're going to gather some information. And this is kind of that head, heart, body approach right from the get-go. So we're going to talk about what's the negative belief that you have about yourself when, let's say, you start feeling dizzy, right? Maybe it's I can't trust myself, or I am helpless, right? Okay. And when you think about that moment when you're having the pain and the dizziness and that thought, I'm helpless, what are the emotions that you have right now, right? I feel sad. I feel frustrated. I feel little. I feel small, right? Okay, yes. And when you're noticing that, what's happening in your body right now? Because I'm noticing that you're crossing your arms and you've closed your eyes, right? Okay, I'm feeling, I feel hot in my face and I feel my throat getting tight and like I want to cry. Okay, what are other times that you have felt this way before? Okay, in my doctor's office, when I told my mom my diagnosis and she didn't believe me. I'm remembering, I argued with my husband about going on that cruise and I didn't even want to go and I'm pissed, right? Like, what are these things? Those are going to become memories that you and your therapist work on with EMDR. You're going to go through them one by one to help take the sting out, right? Because when we're talking about something that happened maybe last week and we're still upset about it now, there's some sort of our brain hasn't figured out completely what to do with it yet, right? Or our heart hasn't figured out, or our body hasn't figured out yet completely what to do with that, right? Then what someone is going to do in the bigger process of EMDR is we're going to make sure that a client has coping skills, Because here's the news about all kinds of therapy, EMDR included, is that sometimes things get a little worse before they get better. And I don't say that to scare anyone, but as we come to realizations, maybe some inconvenient truths, sometimes getting better creates problems that we didn't expect.
Yeah.
It can feel a little wonky. EMDR also can stir the pot, and we need to stir the pot to see what's in there and what to work on, but it can feel a little unsettling at times. And so we want to make sure that clients have coping skills, that they know how to breathe, they have someone to call. If they've got kids, I tell them, what are you going to do for dinner tonight? Pizza, movie, bed, easy, right? We're going to lower expectations for the night. What happens when we're actively desensitizing and reprocessing? Because I don't think I mentioned what EMDR stands for. It stands for eye movement, desensitization, and
Cool.
reprocessing.
I'll put that somewhere in the intro.
We'll
Yeah.
put it in there. Put it in the show notes. When we're actively in desensitizing and reprocessing, that's when the bilaterals happen. And this is where it looks different from traditional talk therapy, is I would ask you, I would say, Yonit, I want you to hold in mind the worst part of that particular memory, that thought, I am helpless. I want you to notice how it feels emotionally and what's happening for your body. And now I just want you to notice whatever comes up as you follow my fingers. And we would do that for about a minute. And your only job is to be mindful and curious about whatever you notice. And you might say, oh my gosh, I'm thinking of, how I didn't know how I was going to be a mom if the dizziness continued. Right? I thought I was going to have to quit my job because I couldn't perform for clients anymore. All right. I thought about how I tried that medication and the dizziness got worse. And my doctor said it was going to get better. Of course it was going to get better. Right. And I'm mad about that. Okay. Notice that. Follow or tap. Right. And the whole session is allowing your head, heart, and body to begin to connect the dots. Because somewhere in you is the ability to make sense of this craziness, because trauma is crazy making. These health complications are crazy making. We feel insane. We feel lost. And so we're taking a moment to regulate the nervous system and breathe as we just notice what's happening in our head, what we're thinking of, what we're feeling emotionally, and what's happening in our body. And over time, what we see clients do is they begin to have these aha moments and connections, and the emotions start to calm down and the nervous system regulates. And they can go, you know what? Even though that medication made the dizziness worse, I got through it and I told that doctor, I'm not taking it anymore. So you're not lost? No. Because you made a decision? Yes. Okay, notice that, right? And we start to have these connections that happen, and clients end up feeling less distressed.
I love this. Again, I don't think I shared, but I'm trained in IFS and AEDP.
Yes.
And so there's so much here that just reminds me of those aha moments that people have when they've kind of reached their own meaning making, their own understanding of what something meant. It's, I tell people, and you tell me if you agree with this, our job is to help people not necessarily escape from pain, but to make meaning of it and hold space for it. So it's no longer affecting them the way that it used to be affecting them. We can't change that something painful happened.
No, I absolutely agree with that, because I always caution people, the goal of EMDR, and really anytime we're dealing with a hard thing, it's not to put a positive spin on it, right? I'm not looking for people to come out of therapy and say, you know what? This dizziness thing is the best thing that ever happened to me. I am just grateful because I have learned so much.
Right. You don't have that agenda.
I'm really glad that medication didn't work for me, because ultimately it led me to my path. If that's what a client concludes, that's awesome. There's nothing wrong with that. But it's not my agenda.
Right.
My agenda is for them to make their own meaning out of that experience and to feel safe doing that without having to spin it.
Right. Yes. I love everything that you just said. And emphasizing this, kind of putting a pin in this, because a little bit later in this conversation, hopefully we'll be able to help guide people toward the kinds of therapists that might help them. This is a
Yeah.
big problem. And one of them that I see come up a lot is well-meaning, so well-meaning like these therapists are so well-meaning. No one becomes a therapist. Well, most people who become therapists, sorry, I should never make never statements. Most people who become therapists because they want so badly to help people. And so it's really hard to see someone suffering and say, I know, like, and not say, I know. You just have to like accept that this is, this is actually meaningful and it's going to make your life better. And like, it's so hard to not do that. But not being agenda driven, I think, is probably one of the most important components of good experiential therapy. I mean,
Mhm.
as you say, it has to really emerge from the person, him or herself. It can't be us putting that message in there. If it's not coming from within, it's just not going to do what it needs to do to
Absolutely.
create healing.
Absolutely.
Yeah. So, okay. So thinking about this process then, so I can see how, I mean, really it could be applied to anything. I'm wondering how, and this is a little more specific to chronic physical symptoms. So you've talked a lot about how you might address someone's feelings around the symptoms
Mhm.
and how potentially helpful EMDR is for that. How might EMDR be helpful when you've investigated someone's symptoms a little further and you conclude the reason that person's nervous system was sensitive is because of all sorts of like complex childhood stuff, like not a single specific event that was really bad, like onset of dizziness, and now I've had a really crappy couple of years,
Yeah.
but I, grew up through age 18 basically constantly being put down. But it wasn't exactly abuse, it was just kind of, criticism. So how would EMDR be helpful in that situation?
Sure. So in that situation, we would potentially target memories of being put down and how that felt, because that doesn't feel good, right? There's this clinician out there, her name's Pia Melody, and she has a really incredibly broad definition of abuse, which is, it's a little controversial, but it also serves a purpose. She says abuse is anything that is less than nurturing.
Hmm.
And I'm like, I kind of love that because it opens up, and it opens up the opportunity to say that didn't feel good. That wasn't okay. That every time I came home with my spelling test, my parents went, that an A, not an A plus. All right. It makes us feel small. It makes us feel less than, right? Those things dysregulate our nervous systems, right? Because we don't feel safe. We don't feel secure. And that's the first thing that our nervous system is looking for, is safety and security. Am I safe? And am I secure in my relationships? That's what it's reading for. It's not assessing, well, mom was having a bad day.
Right.
Dad was in the military, so he was chronically stressed. And, but he did the best that he could. Yes, credit to the parents that are doing the best that they could. I hope everyone out there had parents that are doing the best that they can. And it doesn't mean that we didn't get bumped and bruised along the way, and that we ought not to pay attention to that.
Right. So similar approach then for guilt. So say someone has a lot of guilt over missing time with the kids because of feeling sick and not being able to do things like he or she normally would. You would approach it similarly, helping them kind of think of times when that's happened, like the representation that they have of this particular this particular scenario, and then working through that with EMDR.
Yes,
Yeah.
absolutely. Absolutely.
Okay.
There's three big things that we tend to see in EMDR. And part of this is the EMDR framework. So of course we see it this way.
Right. Sure. Fair enough.
So this is how we kind of break things down, is we see a lot of, I'm not good enough, right? I'm broken. I suck. I'm all these things, right? So the shame and the guilt. The other thing we see is a lack of safety. So I'm not safe. I can't trust. And the other thing is control and choice. So I am helpless. I am stuck. I can't help myself. A lot of our pain is held up in kind of those three categories of things.
Wow. Such a great summary. That's, yeah. I mean, probably universally applicable. Yeah. And
So when you
definitely.
talk about, the person that, feels guilt because they're not able to show up for their kids the way that they had hoped, that like, I'm a bad mom. I suck. I am failing at this. That is a good reason to come on in.
Yes. Yes. Okay. So that makes me think though. So there's some magic that EMDR is doing, but it's not just the EMDR that's magic. You really have to be able to help the client flesh out and develop this representative memory or this representative idea, so you have something to work on. Is that right?
Yes.
So I imagine that people who use EMDR, it's not like you're just going to kind of like chat with people and then, okay, so you had this traumatic thing. Cool. Let's EMDR it. You have to have skill at breaking down all the components of someone's difficulty, which is not simple. That's not a simple process.
No.
So I know I'm jumping ahead a little bit here, but what other skills then should people be looking for if they're thinking about EMDR and they say, wow, okay, cool. Maybe this will help relieve some of this stress, or this will help me at least find meaning in some of the stress that I'm experiencing. What other skills should they be looking for in a therapist? Considering now I know that there's some skill here beyond just kind of EMDRing someone over a traumatic memory.
Yeah. So there's a couple of things. The first thing is that people should almost instinctually feel safe with that person. You just get that gut feeling that you are getting good vibes from this person. You need to feel safe, heard, and respected by your therapist. Because at the end of the day, you can have a therapist trained in EMDR or brain surgery or whatever. The most powerful component to any therapeutic relationship is the process is the relationship you have with that therapist. If you feel like they are minimizing your experience or not taking you seriously, or they're second guessing you, or there's parts of your lifestyle that they don't understand because they're not culturally competent, you need to move on. You just need, I don't care if they're the best, I don't care if it's Francine Shapiro herself. If you don't feel safe, heard, and respected, move on. You're the consumer, you choose your providers. The second thing is that in EMDR world, there's a hierarchy to EMDR therapists, if you will. There's people who are trained, which means that they have gone through their basic training and they are competent and capable of doing EMDR. And then there's certified, which means that they have seen a minimum number of clients. They've seen at least, I think the number is 20 clients, which still even is not that many, in so many hours of practice, and they've received consultation, and they have done an application with the International Association, and they've sort of put in the time and proven that they are competent. So that can be a good sign as well, is to go to the EMDRIA website, EMDRIA, I think it's .org maybe, and they have a directory of who is certified. And that's a good sign, because then they've received additional training, advanced training, and they've sort of proven their worth.
Sure.
Right?
And
but in addition to that, icing on the cake, someone who's trained in IFS.
Oh,
IFS.
Shout out to IFS. Yes.
IFS and EMDR play very well together. They play very well.
Okay. So, because I was just going to push back on the certification, and again, I'd love to hear your thoughts on this. What I've observed is, well, at least let me put it this way: I have to refer a lot of people to therapy. I refer people. I refer hundreds of people to therapy, and it's been really hard to refer people to therapists who match with them. I mean, again, some of this, as you said, number one is chemistry. You really want to look at the chemistry. And so I understand there's some amazing therapists out there. You don't have chemistry, you don't have chemistry. But what I've had trouble with is sometimes I've referred people to people with so much training, and then they just they have lots of training, but there's like a people skill thing that they don't have. So I just want to say, I want to ask you, how much should someone weight the relationship or the chemistry versus kind of the person's training level or credentials?
So say that again. Because I was on my head. I was like, oh my God, I know exactly what you're saying.
I'm so glad you're saying. Yes. Yes, I'm sorry. I know it's so
again,
hard.
Yonit.
It's so hard. Yeah, it's so hard. So what I was asking was, if someone's like, okay, so I talked to 5 therapists, one of them certified, and like her credentials are just amazing. And I talked to this other person who just like happened to be trained in EMDR, but like I just got a really good vibe from this person. Is it better to go with the good vibe, the good chemistry, or with someone who has better training or more credentials?
Oh, I wish I had a straightforward answer for you, because the truth is someone who's newly trained might be getting regular consultation.
That's true too.
Which means that you're going to get amazing service, whereas the person who's been in the field for a long time might not be getting that kind of consultation and oversight.
Right.
And might be a little loose in their application because they have the confidence to go off script, so to speak. Here's a magic number. If I could give you a magic number, is that to work through one particular memory, right? So like you've met your therapist, you've done your first intake appointment, you've talked about your history, and you're actively doing the eye movements. EMDRIA says you're looking at like 8 to 12 sessions from that first appointment to working through a first memory and like really like, okay, like I'm getting the groove and I'm feeling better. And so minimum 8 to 12 sessions is what EMDRIA would say. So if you're at that 5th session and you're like, this is still not feeling it, I'm still not feeling it, I don't know where we are in the EMDR. And also, so if that's happening, maybe consider a switch. But I also want people to feel comfortable advocating for themselves. And you can, even if you don't know what an appropriate answer would be from your therapist, you can ask your therapist, where are we with the EMDR stuff? Like, what's the plan? You get to ask your therapist that and see what they say. You don't have to know what a right or good answer would be to ask that question.
Yes. Yes. Wonderful. Thank you for saying that. I think there are 2 positives there. A, it will help you figure out if it's the right fit, but B, agency. It's its own corrective experience to actually be like, feel like you're empowered to actually ask a question like that. So that in and of itself is therapeutic, just being able to ask. And also, especially if it's well received, I think that's an additional corrective experience. If someone has the trust in you to be able to say, yeah, let's talk about this. So, okay. Thank you for that. And sorry for sending you that curveball of a question, but I appreciate that. So, one of the things that you said earlier that I'd like to circle back to is you said EMDR and IFS play very nicely together. And of course, I want to talk about that too, but it makes me think of a different question that was very important for me to ask you. So one of the criticisms that I've heard of EMDR, and one of the things that kind of makes my radar go up a little bit, is that sometimes I see therapists talking about EMDR like it's a blunt force instrument. Like you should just EMDR everything. Like anything bad that ever happens, any difficult feeling, any difficult thought, like we're going to EMDR that. So could you comment on that and help us start to understand when EMDR is actually super effective and the right tool, and when maybe someone would want to at least find a therapist who has multiple tools? I guess that should probably always be the case. But anyway, I think you know where I'm going with this.
I hope it's always the case.
Yes.
So here's the thing. Francine Shapiro herself said EMDR was never meant to be used in isolation. It was never meant to be a standalone approach. It was always meant to be used in conjunction with psychoeducation, receiving information, coping skills training, art therapy, IFS, once that entered the scene, like it was always meant to be used in collaboration with other techniques. So I think it is important for people to know that, right? And also to know that, like, if they feel like, why aren't we doing EMDR yet? It's because you needed a little sprinkle of something else to make your EMDR more effective, right? And to have a better experience. I also think that, EMDR is not for everything and everybody. I have clients that they came in wanting to do EMDR and I was like, nope, like this is just not a good fit. It's just not a good fit because of how their nervous system is regulated. Maybe something is going on in their life where they're going to be out of town for a while. And I'm like, we're not going to go down this road. If you're going to be on vacation for a month, like we're going to put it on pause. There's a lot of reasons why we make a decision together about not doing EMDR or doing EMDR, which creates another point, is that clinicians should be getting consent from you to do EMDR. They shouldn't just say, good point, Yonit, follow my fingers. You're like, what the hell is that?
Right.
Nobody talked to me about this.
Right.
Nobody prepared me for how I might feel after an intervention like that.
Right.
It's gonna, right. So EMDR is a really collaborative experience. One of the things I love about it is that clients are very much setting the pace, because it's their own adaptive information that's coming in, their other memories, their other beliefs, their breath, regulating their body as they revisit those things with the therapist in the room. The client has the brake and the gas in this process. The therapist is helping you focus, right, on what's going to be helpful for you to focus on. But yeah, EMDR was never meant to be used alone. There are other approaches that work really well. But EMDR is my personal favorite. And I think because it is so holistic, it's not just talk therapy.
Right. So I'm curious then, I mean, again, it sounds like such a big tool. I'm thinking of a tool belt, and like you have these little, this is a cool thing. I picked up some like motivational interviewing stuff that I sprinkle in here and there, but this sounds like a big tool that you would be able to rely on a lot. So do you find that with people who have particularly complex problems that you'll do EMDR with a particular issue, and you'll also have to work with IFS or some other kind of experiential modality to kind of not do cleanup, but also really help them process something all the way through? Like, do you find you have to use multiple tools sometimes on the same problem?
Absolutely. Absolutely. So just as a quick example of that, because I do have a little bit of training in IFS, I haven't done like the big immersive experiences, but an example of that might be, oh gosh, let me think. If a client has something, okay. Can I give you an example from my own life?
I would love an example.
Okay.
Yes.
So after the birth of my first child, I had horrific back pain, absolutely debilitating back pain. And the worst part that comes up for me when I think of that is there was a night where I was holding him. He was just a baby. And I went to go put him down in the crib, and I couldn't bend over far enough to lay him down. I kind of had to, I didn't drop my kid, bear with me, but I had to essentially drop him into the crib because I couldn't reach all the way down to the mattress.
Wow.
And I stood up and was like silently crying because I didn't want to wake him up, but I was in so much physical pain that I couldn't not cry, right? So if I'm working through this with EMDR, the thought that comes up for me is I'm failing, right? And where IFS comes in, if I was my own therapist here, I might ask myself, Melissa, is there any other part of you that says anything besides you're failing? Yes, there's a part of me that says, oh my God, I am trying so hard right now. Like I can, and even as a therapist, I say, where do you feel that? I feel that in my bones.
See it. I feel it. Yes.
Right? I feel it in my bones. I am trying so hard. Like, it makes me want to curse. I am trying so hard. I'll hold
Right.
back for your
Right.
viewers. Right? And now all of a sudden I'm having a different experience right now talking about it. I feel fired up and I feel alive. I'm trying so hard. And that would be that IFS work. Okay, can both parts of you come into that memory? I am failing and I'm trying. I don't even feel that I am failing anymore. I am just like, I just see myself crying, like knowing that I just plopped my kid onto the mattress. And I'm like, I am trying so hard. And I am remembering how I problem solved, right? I saw doctors. I tried everything under the sun to try to fix this back pain, right? And now I'm all of a sudden, I have switched from I am failing and I am helpless to I worked my butt off, right? And even still, I still have flare-ups of back pain. But part of my new script is I try my butt off. I do everything under the sun. Because also when it comes up, I feel like I do feel powerless. The back pain to a certain degree takes away some of my power. There's things that I can't do when I have a flare-up. But I have a different emotional relationship with that pain now than before.
Right. That's beautiful. And a really, really potent message for people with chronic dizziness as well, because
Mhm.
I also had back pain. And for me, I don't say to myself anymore, "Oh, I have chronic back pain," because it's not chronic anymore. When it shows up, I'm like, "Oh, my back hurts today." And that's it.
Mhm.
There's no like overlay of meaning and this means this and I did this and it's going to be like that. Like there's just none of that. It's just like, "Oh,
Mhm.
okay, cool. It hurts. I probably did something or maybe I'm upset about something and it's
Mhm.
kind of manifesting in my body." That's it. And so that's the point is we are neither of us, no matter how many skills we have, we're never going to be able to stop people from feeling physical discomfort.
No.
Every single person who recovers from chronic dizziness is going to feel dizzy at some point in their lives because you and I feel dizziness at some point in our lives too.
Mhm.
I could go on a huge soapbox about this, but needless to say, dizziness is a normal human sensation. Pain is a normal human sensation. It- It's so much of it is not, this isn't all of it. We understand the fact that it's there all the time is a huge problem and we're working on that.
Mhm.
But so much of it is how much suffering does it cause when I do have a sensation?
That's right.
So what you're
Mhm.
describing is working through a process like this and opening it up, not just with EMDR, but having a therapist who can really help you investigate and get clarity on all the different components of something,
Mhm.
right? That's really what we're saying,
Absolutely.
is gonna find all those pain points around the pain that we can now relax. And
Yes.
is that
Yes,
accurate? Yeah.
absolutely. And I would add to that, it's so important to for a therapist to be able to do that and for you to feel comfortable doing that with your therapist because there's parts of this process that are not logical, right? So, and it's because it's what we have to acknowledge that because otherwise we're like, oh wow, that's a lot of woo. That sounds really cheesy. Like, what is she talking about? But as an example, one of the things that I learned when my back pain was at its worst is I would literally stop breathing. I would hold my breath and I would catch myself doing dishes and realize I've stopped breathing and I would, because I would contract. So if my therapist, again, a little IFS a sprinkling here. If my therapist were to say to me, Melissa, that part of that version of you that's at this kitchen sink, not breathing, what does that part of you need right now? The answer I get, and this is just me, and it's going to be different for everybody because this is client led, is I get an image. I don't get a word answer. I get an image of me coming behind myself and putting my hand between my shoulder blades, which is not where my pain is, but it seems like a nurturing point. I don't know. I see myself putting my hand between my own shoulder blades and saying, breathe, right? Just like it's okay, right? And visualizing that helps my nervous system, right? Whatever it takes. Well, I don't know why that image is coming up. I don't know why it makes sense. But when I think of it, it makes me feel calm. So, okay, notice that. Notice that version of you coming behind you and telling you, breathe.
Mm. You know, this is just bringing me back to what we started our conversation with, this idea, this relationship with your body, feeling betrayed by your body. But what you're describing is a process. The requirement for this to work is building trust with
Yes,
yourself, right? And
absolutely.
that's why people struggle so much on their own, because they've lost so much trust, especially when it's something physical, that they don't feel like they can trust their own intuition anymore. And so they
Mhm,
may, in fact, just like I think you and I both believe, people already know, their nervous systems already know what they need in order to
mhm,
heal, but it's just so obscured by so much noise and so
mhm,
much lack of trust
mhm.
that they're not able to get the message the way that you did.
Yeah. Yep.
Yeah. So fascinating. So any other thoughts, any other tidbits you want to share on EMDR for physical symptoms and why it's so effective for those types of situations specifically?
I think that a big thing that comes up for me, and I was actually watching one of your videos yesterday, and I was like, oh, good point, Yoni, is talking to your audience about what I took away from what you said was your needs matter. Your emotions matter. And that's a big part of, I feel like, this healing experience. I use the word reality. What is your reality? Right. Um, so just as an example of what I mean by reality is, like, we're both looking at this screen right now and we can see these buttons with our names in them,
Yeah.
right? I want for you, don't tell me what it is, but decide right now, what color is that button? Decide, do you know what color it is?
It's
I,
it's like a bluish purplish thing. Yeah.
okay.
But I've looked at it a million times, right?
I would call it lilac.
Okay.
But here's my point. Is your answer wrong?
Right, right. No,
Your
for
answer is not wrong.
sure.
It's a bluish purple. That's an answer that my husband would give. It's a bluish purplish thing, right? My mother was a watercolor artist. I have other
Oh.
information within me. That's
Mm.
lilac.
Mhm. Yeah.
Your audience, all of them, if they did this with us, they're going to have, people are going to be like, it's purple. Some people might say gray,
Yeah. Yeah.
right?
Yeah.
So an important part of this is your reality matters. It doesn't, if you're like, well, I don't know what happened to me. It really wasn't. Other people have said that's not really a big deal. That's just how people parented back then. It's just because it was only one time. I don't care. Your pain matters, right? Again, I don't care if it's strep throat or cancer. I'm not telling anybody that their pain doesn't matter.
Yeah.
It matters.
It
And
matters.
that's a big, you talked about that self-trust. In it, that self-trust, I just want to tell people, like, that's a big part of what gets people into therapy in the first place, is they finally say, you know what? This pain, this discomfort, this stress, this overwhelm that I'm in, it is enough for me to say, I'm done. Something's got to give. I'm done. It is time to start therapy.
Mhm.
Doesn't matter
Yes.
if you've only had your symptoms for a week or you've had them for 6 months. Everyone is on a different timeline. Everyone gets to decide. You get to decide when you want to decide that enough is enough. Your pain is enough. It is time to get help.
Hear, hear. And you know what? I've said, Melissa, I really think pretty much everyone who goes through a vestibular event should have therapy.
Mhm.
I think, I mean, this is my vision of the world, right? But there is not a single person who walks away from a vestibular event and doesn't have some kind of stuff. I mean, some people brush it off much more easily. I see that too. Those are people, again, who have a, a lot of lack of risk factors, I guess. They have a lot of resources in their lives. They're not dealing with a lot of stress. They have good family support systems. They also just kind of naturally have some traits that kind of let them brush things off a little more easily. But everyone should be offered therapy
Mhm.
after having a vestibular event. And I think I'd love to hear what you have to say about some of the stigma associated with feeling weak. Oh, I had to go to therapy. I just had this medical issue and my body was really uncomfortable. And so I was so weak that I needed help. Like, what would you say to that? Because it's so clear that people need this.
Yeah. I think that, I mean, we could look at it through the lens of, you're weak, you're suffering, and you need help. Or you could look at it through the lens of, I choose health inducing things in my life. I don't drink water because I'm weak, right? I don't think like, oh, I'm such a weakling, I'll get dehydrated if I don't drink, I better drink, right? I drink because it's good for me, right? I go to therapy because it's good for me, not because, oh my gosh, I have all these issues, but because it's good for me. It's health enhancing.
Right.
Right.
It
So,
is.
so why would we not do it? And I also want to say to people that it is good advice to take care of an issue while it's small. Therapy is not a magic bullet. You're not going to feel great after your first, you're not going to experience results from your first therapy session, right? Like it's not a magic bullet. It's not a quick fix. If there was a quick fix, we would have done it by now.
Oh, for sure.
Right.
I would have put it a final I tell people, I put on a final YouTube video, tell you the secret and off to go do something else, There isn't.
And here's something else that I really hope people would walk away from. If there's people listening like, well, I don't have a traumatic event, like I don't have this thing. The effect of stress is cumulative, which means that all these little stressors add up. It's like a Jenga tower, right? You might just have like, this little thing, even just everyday kind of things, but they add up until finally you have one more little thing. Or maybe you have a big thing that sends your whole Jenga tower crashing down. And I hear that from people that come and they're like, oh my gosh, I was doing so well. Why now? Why did this one little thing send me over the edge? That doesn't make any sense. I'm like, well, how high was your Jenga tower?
Right, exactly.
Right?
I call it the
Because
stress
you didn't
bucket.
have anything big. Maybe you had what I call a good enough childhood, right? There was nothing big. Maybe there was some teasing. A lot of people get teased. You moved on. You had a crappy boyfriend in college, but you moved on, right? Like a lot of us do all these things, a lot of us go through, but finally you got to a point where you were like, yeah, like I've been people pleasing most of my life, but it never really stopped me, right? Or I've been a type A personality all my life, but it never really stopped me until your Jenga tower got high enough that you crashed and burned. And now you have inflammation or you have dizziness or you blah, 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 whatever it is. You're having panic attacks and you don't know why. It's because it was a slow build, right? It's like sunburns. One sunburn, not a big deal. 2 sunburns, not a big deal. A lifetime of sunburns that weren't a big deal. And, now maybe there's skin cancer and you look back and go, I don't remember any of those sunburns. Did I get sunburned? Probably did. Most people do.
Exactly. Oh, I love that metaphor.
Right.
That's a good metaphor. And I want to just drive this point home because I know sometimes people listen to me because I'm an audiologist and then they're like, wait, why should I go to psychotherapy? Like, this isn't a mental health issue. We're not talking about mental health. We're talking about your nervous system. Just like we talked about from the very beginning. When your nervous system thinks that there's danger lurking around every corner because you've reached the top of your Jenga tower and it's about to collapse, all sorts of physical things can happen. And one of the physical things that can happen is your brain stops interpreting vestibular information correctly. And that's not a mental health problem. No, you're not having anxiety and depression, but it's still the Jenga tower. It's the exact same thing that leads people to have anxiety and depression and panic attacks and emotional breakdowns or whatever it is that, what other terms you're thinking of. Chronic physical symptoms that are medically unexplained are happening for the same reasons.
Yes.
They're happening for the same reasons. We're not saying you have a mental health issue. We're not saying it's psychological or it's all in your head. We're saying your nervous system is not functioning well, and it's for the same reasons.
Yes.
Awesome. This has been so much fun. I'm so curious because I'm just such an experiential learner. Now I want to go get EMDR to just experience it. So I should go check that out. But I just wanted to give you the opportunity. If there's anything else you'd like to share, any messages of hope or advice or anything else you'd want to share with people who are dealing with chronic dizziness right now.
I would want to say that it can be different. I'm not going to tell anyone that it gets better because that's a loaded word, but it can be different. It doesn't have to be exactly this way. And therapy can help. It's not the only thing that helps, but it can. EMDR isn't the only thing that it helps, but it's pretty amazing.
Yes.
And it doesn't have to be a last resort. I encourage people not to let therapy be your last resort. It's a harder climb out of that hole if we wait and wait and wait. We don't have to wait. There's options.
Agreed. And if it's okay, I'm going to just come out and say it will get better when you're doing I guess, again, I'm going with the Jenga tower. If you're taking care of the Jenga tower, your physical symptoms will get better. I have seen it in, at this point, thousands of people. The number of people who comment on my channel, definitely in the thousands. I see it all the time. So I know everyone sometimes has that sense, well, maybe I'm the weird one who it's not going to help. Give it a try.
Give it a try.
You won't know until you try.
I mean, I can say from my office, I've seen hundreds get better, right? I don't have the online audience that you've got. So it's like you're in person, I can't see thousands. But
hundreds.
People are getting better. They are getting better. And it's lasting a lifetime. Yes.
Oh, what a beautiful note to end our conversation on. Thank you so much.
Absolutely.
Such a pleasure. And I know some people are going to hear this and they're going to be like, oh my gosh, I want to work with her. So can you work with people outside of Utah or only in Utah, first of all?
We are right now, therapists can only work in the state in which they're licensed. So for me, that's Utah.
That's Utah. Okay. So if someone from Utah, I know I have viewers all over the world, if someone from Utah would like to get in touch with you, or I know you put out content, you put out great content on Instagram. So anyone can follow that. So I will list your social media accounts below as well as your website. So please check the video description if you would like to get in touch with Melissa or see some of her really, again, useful, informative stuff that she's putting out just as a public service to everyone. And I also, what else was I going to say? If, just like you were saying earlier, if someone's outside of the state of Utah and wants to look for an EMDR therapist, that person can go to the EMDR directory, which I will also put a link to in the video description.
Yep, absolutely.
Okay, wonderful. Wonderful. Well, again, thank you so much for being here. And thank you, everyone, for tuning in and joining us this whole time. If you have questions or comments for me or Melissa, I can relay them to her. So please put them in the comment section, or if you're watching this as a podcast or listening to this as a podcast, rather, please come over to YouTube to leave your comments and questions. It's so much fun to be part of that conversation. And as always, please share this video if you found it enjoyable. Please subscribe to the podcast or subscribe to my channel. All these things help me reach more people. As always, thank you, and we'll see you again soon. Take care, everyone.